What's up, everyone? Last week I was role-playing with Dr. Ryan the role of the nervous system, the spinal cord, and the adjustment in our patient's health. And I was telling him that just a couple of years ago, I would explain this almost exclusively by saying that a hard bone shifted out of place, put pressure on a soft nerve, and then that would cause headaches, neck pain, back pain, you name it. But my perception was completely realigned by a quarterly meeting that Dr. Chris gave a couple of years ago as well, with really all of the amazing changes that we see in our patients' health. And the reason that we see so many amazing breakthroughs with our patients is because we're using the spinal cord and the nerves to literally make changes to the brain. And one of the big pieces of this shift for me was the role of the intervertebral disc in the function of the spine and in the stimulation of our spinal cord and our brain. So this week we're going to start with some basic anatomy and physiology of the intervertebral disc. We'll move through later this week on why it's so important to our patients and why it plays a role in their health. So to help me illustrate this, when we look at the disc, it's much like this jelly donut. The inner portion is the nucleus pulposus. It is mostly fluid. There are some collagen fibers in it, which gives it a almost jelly-like presentation. And then the outer portion of the disc is the annulus fibrosus, which is a much more concentrated collagen network. It's there to protect the inner workings of the disc. Together, they allow movement and stimulation throughout the entire spine. And to do so, they need to be nice and thick and plump like these guys. As they start to get compressed, as they go through the degenerative process, they're no longer able to perform their jobs the way that they need to. For reasons that we will detail later this week, this leads to a whole host of health conditions and disease processes in our bodies.